Hi, Dr. Peter Montgomery, Family Practice. Been talking about the 5 W's to stop the coronavirus, about that we all are washing, waving, wiping, and whoa, don't touch this in an attempt to stop the spread of the coronavirus. I'm here to also give you an update of the national lockdown. As you notice, we're locking down everything, trying to stop the spread of the coronavirus. On day one, I was all like, whoa, what is this? And now it's Tuesday, and I'm like, whoa, I think we can do this. Okay, and that's where we're trying to get to. I'm with a medical healthcare system, and they sent out advice to all of us to wear goggles. This is me on the first day. Wear goggles, gloves, and mask in an attempt to, number one, not pick up the virus from our patients. We're already doing these things. This is standard medical training. We're also trying to give people comfort. Look, we're not going to be giving it to you. We're not getting it. We're trying not to let know the patient before you is not spreading it to you, that it's safe to come to the doctor. We're working on triage on the phone to keep people from, sick people not coming to the medical clinic, and divert them to COVID testing, and let people know, because we still have to take care of people with medical conditions and heart conditions and diabetes, and they're sick with something else, and depression. We still have to do all the other things we do, and we also have to take care of the seasonal flu and the COVID. And we have a plan for this. Our medical system, I'm with SSM in the St. Louis medical area. And our hospital system is very organized. It's a 10 hospital system over many states. We have a lot of assets, and we're meeting every morning at 7 a.m. by phone. We can dial in, listen to the infectious disease doctors. They're giving us the update, the breakdown. The administration people are telling us what they're doing. Our system is setting up drive-through testing. The one's just 5 miles from my office, which is great. They're going to be expanding that. We currently have one. They're going to have 5 up pretty soon in the St. Louis area. And they're getting that news out to the news outlets so people know where to go for this. Our system is very organized, working on this, and everybody's sacrificing. Everybody's doing the things. During the meetings, one of the doctors called in and says, look, I'm currently sick, I'm on medical leave. Can I work the triage phones? These are our doctors. They're really stepping up their game. They're doing whatever they can to do. The nurses, the administrators, everybody's doing what they can. Previous generations, they had to go fight a war, had to deal with the Great Depression. We have to go through this, and we are stepping up. Everybody I'm meeting is doing their part. So let me show you a little clip from a newspaper article about the Spanish flu in 1918 and what we did then and how we can do something similar today.
Here's an article I found in the Quartz Online magazine about the 1918 Spanish flu and showing why social distancing works. Here's a response from Philadelphia. The Spanish flu had hit. It was a very similar virus that we're dealing with. It had a 3 to 6% death rate and was very contagious. It had hit in the spring, had calmed down during the summer, and started to return in the fall. In Philadelphia, they held a parade with over 200,000 people there. They were honoring the soldiers who were leaving to go to World War I. It's a very great reason to have a parade at a really bad time, because this was the reaction. A few weeks later, a spike of the Spanish flu, and it came back and had a terrible effect. The leaders in St. Louis had a chance to see this coming. They were hearing that the Philadelphia hospitals, 31 hospitals, full, sick, people were dying that shouldn't have died because they couldn't get proper care. Even at the quality of care they had back then, they couldn't get it. And we had time to react here in St. Louis, and they shut things down. They shut down public buildings, shut down schools, shut down parks, asked churches to shut down, and they did, and people sacrificed, and the rate of people dying was one of the lowest in the country. Thanksgiving happened. People went from out of town, spread more of the virus in large groups, and there was a last wave at the end that may have been avoided if it wasn't for that timing. But it just shows what social distancing can do. And so we're doing this on a national level now. Where every city, every state is trying to enact similar restrictions. People who study epidemics now call this the St. Louis model. of social distancing, and we're giving it a try here to see if we can flatten the curve, decrease the death rate. People who could be cured getting an opportunity to get into the hospitals to get the cure that they need and get the medical care they need. It is causing financial difficulty for everyone, and hopefully this doesn't have to go on too long, but going on too short is actually a problem. As we can see, we need to do this for the right duration of time too. So we are trying to stop a similar response to the 1918 Spanish flu. Thank you for everybody doing what they can to stop the spread of the coronavirus, the COVID-19. Social distancing works. Proper hand washing. I'm calling it the 5 W's in my office. Whatever we can do to stop the coronavirus. I'm going to give an update of National Shutdown Day 3 tomorrow, and we'll see what we can do to help stop this. Thank you very much.